weeks or even months without fully resolving. Unlike typical acne that might be spread across the face, hormonal acne often appears in the same locations repeatedly. The hormonal pattern of acne is highly telling. Many women notice breakouts occur in a predictable pattern related to their menstrual cycle. Breakouts might appear 3 to 5 days before menstruation begins, resolve during menstruation, then reappear in the luteal phase, after ovulation. This cyclical pattern is a clear indicator of hormonal involvement. Some women break out only during specific phases of their cycle, while others experience breakouts throughout the cycle with worsening at predictable times. Hormonal acne results from heightened skin sensitivity to androgens, particularly testosterone and DHT, dihydrotestosterone. These male hormones stimulate sebaceous glands to produce more sebum, even in the presence of normal hormone levels. Additionally, androgens promote follicular hyperkeratinization and may increase colonization of acne-causing bacteria. Women's testosterone levels fluctuate with their menstrual cycle, with higher levels during the luteal phase, explaining the predictable timing of hormonal acne breakouts. Recognizing hormonal acne requires tracking your breakouts. Keep a calendar marking breakout dates and your menstrual cycle dates for 2 to 3 months. If breakouts cluster around specific menstrual cycle phases, hormonal acne is likely. Polycystic ovary syndrome, PCOS, a condition affecting ovulation and hormone regulation, often causes severe hormonal acne. Women with PCOS typically have elevated androgen levels and irregular menstrual cycles. Topical acne treatments alone are often insufficient for hormonal acne. While they help manage symptoms, they don't address the underlying hormonal cause. Therefore, treating hormonal acne often requires systemic, oral, medications that regulate hormones or reduce skin sensitivity to hormones. Hormonal contraceptives are the first-line treatment for hormonal acne in women who desire birth control. The hormones in birth control pills suppress ovulation and, importantly for acne, reduce circulating androgen levels. Specifically, oral contraceptives increase sex hormone-binding globulin, SHBG, a protein that binds androgens and makes them unavailable to skin cells. The result is reduced sebum production and decreased follicular keratinization. Not all birth control pills are equally effective for acne. Combination pills containing estrogen and progestin are effective. However, some progestins have androgenic properties, meaning they act similarly to testosterone, and can worsen acne. Progestins with lower or no androgenic activity include norgestimate, desogestrel, and drospirenone. Birth control pills specifically approved for acne treatment by the FDA include orthotricycline, norgestimate, estrostep, norethindrone, yaz, drospirenone, and bayaz, drospirenone with additional vitamins. These pills typically show acne improvement after 3 to 4 months of use, with maximum improvement by 6 months. Starting a new birth control pill doesn't immediately improve acne. Acne often temporarily worsens in the first 1 to 2 months as your body adjusts to new hormone levels. This temporary worsening isn't a sign the pill won't work, it's normal. Stick with your chosen pill for at least 3 months before concluding it isn't working. If after 3 months acne hasn't improved, discuss switching to a different progestin or a different pill formulation with your gynecologist or dermatologist. Spironolactone is an alternative or complementary treatment for hormonal acne. This medication is a potassium-sparing diuretic that also acts as an androgen receptor antagonist, blocking androgens from affecting skin cells. Spironolactone is typically used at doses of 50 to 100 mg daily for acne treatment. It's often prescribed in combination with birth control pills for additional effectiveness. Spironolactone requires careful monitoring. Potential side effects include dizziness, lightheadedness, menstrual irregularities, and breast tenderness. More serious but rare complications include elevated potassium levels that can affect heart rhythm. Regular blood tests monitoring kidney function and potassium levels are necessary when taking spironolactone. Despite these considerations, many dermatologists consider spironolactone an excellent option for hormonal acne, particularly when combined with topical treatments and possibly birth control pills. Lifestyle factors significantly impact hormonal acne. Stress increases cortisol production, which increases androgen activity and sebum production. Implementing stress reduction techniques like meditation, yoga, regular exercise, and adequate sleep improves hormonal balance and acne. Regular aerobic exercise appears particularly beneficial for hormonal regulation. Diet influences hormonal acne through multiple mechanisms. High glycemic foods spike blood sugar and insulin, stimulating sebaceous gland activity and androgen production. Reducing refined carbohydrates and sugar while increasing complex carbohydrates, fiber, and whole foods helps regulate blood sugar and improve acne. Some research suggests dairy products, particularly skim milk, may trigger acne through hormonal pathways. Reducing dairy or switching to hormone-free milk might help if dairy appears to worsen your acne. Insulin resistance, common in women with PCOS, worsens hormonal acne. Reducing refined carbohydrates and sugar, eating regular meals with balanced macronutrients, and maintaining healthy body weight improves insulin sensitivity and can significantly reduce acne. Adding inositol supplementation may help with insulin resistance in some women. Discuss this with your healthcare provider. When to consider professional treatment for hormonal acne. If your acne is severe, widespread, or causes significant psychological distress, see a dermatologist and gynecologist together. If topical treatments haven't adequately controlled your acne after 3 months of consistent use, discuss systemic treatment options. If you suspect hormonal imbalances, irregular periods, excessive hair growth, fertility issues, see both specialists. Guide 8. Natural and evidence-based home remedies for mild to moderate acne. While prescription and over-the-counter acne treatments are scientifically validated and highly effective, several natural ingredients have research supporting their acne-fighting properties. These natural remedies can supplement professional treatments or be used alone for mild acne. Understanding which natural ingredients are evidence-based versus marketing hype is crucial. Tea tree oil is one of the most researched natural acne remedies. Multiple studies demonstrate its antibacterial and anti-inflammatory properties. Tea tree oil kills acne-causing bacteria and reduces inflammation associated with pimples. However, undiluted tea tree oil is irritating and can cause contact dermatitis, redness, and dryness. Always dilute tea tree oil with a carrier oil like coconut oil, jojoba oil, or argan oil before applying to skin. A typical dilution is 5 to 10% tea tree oil mixed with carrier oil. Apply this diluted mixture as a spot treatment to individual pimples using a cotton swab. Don't apply to your entire face, as this may be overly drying. Aloe vera has well-documented anti-inflammatory and antimicrobial properties. Pure aloe vera gel, applied directly from the leaf or as a pure gel product, soothes inflamed acne, reduces redness, and promotes healing. Aloe vera doesn't have the side effects associated with many acne treatments. It won't dry your skin excessively or cause irritation. Apply pure aloe vera gel as a spot treatment or all over your face as a lightweight moisturizer. Most people tolerate aloe vera well, though some experience mild irritation. If you're allergic to plants in the Liliaceae family, lilies, onions, garlic, you might react to aloe. Honey, particularly raw and manuka honey, has antimicrobial, anti-inflammatory, and healing properties. Raw honey contains enzymes and compounds that fight bacteria and reduce inflammation. It's gentle and suitable even for sensitive skin. Apply raw honey as an occasional face mask. Mix a small amount with water to create a spreadable consistency. Apply to clean skin for 10 to 15 minutes, then rinse with lukewarm water. You can do this 1 to 2 times weekly. Some people apply honey directly to pimples as a spot treatment. Honey is gentle, affordable, and many people find it effective for mild acne. Green tea contains powerful antioxidants called catechins that have antibacterial, anti-inflammatory, and sebum-reducing properties. Studies demonstrate that topical green tea application reduces acne severity. Brew strong green tea, allow it to cool completely, and use it as a rinse after cleansing, as a toner, or apply it to your face with a cotton pad. Alternatively, use a face mask or moisturizer containing green tea extract. Many commercial skincare products now include green tea for its antioxidant benefits. Most people tolerate green tea topically well, though those with sensitive skin might experience mild about acne. Biology helps reduce stigma. Advocacy for acne as legitimate medical concern, not purely cosmetic, helps ensure insurance coverage and professional attention. Acne affects mental health, self-esteem, and quality of life. It's not just appearance. Supporting those with acne through listening, normalizing their experience, and avoiding acne stigmatizing statements helps. Telling someone, "Just wash your face," or "Everyone gets acne, get over it," minimizes their legitimate struggles. Pushing for better acne education in schools helps teenagers understand acne and proper treatment earlier. Supporting dermatology access for all people regardless of income helps ensure everyone can access appropriate care. Advocating for inclusive acne research including diverse skin types ensures treatments developed work for everyone. Guide 80, Acne and the Senses, Smell, Touch, and Sensory Aspects of Skin Care. Beyond visual appearance, acne and skin care involve other senses affecting experience and compliance. Smell of skin care products affects whether people enjoy using them. Pleasant-smelling products increase compliance due to positive association. Some people prefer fragrance-free products to avoid irritation or strong smells. Touch sensations affect compliance. People enjoy using products that feel good on skin. Smooth-absorbing serums feel better than sticky formulations. This affects long-term routine adherence. Texture of products affects experience. Lightweight, smooth textures feel pleasant. Heavy, thick products feel uncomfortable, affecting compliance. Taste concerns arise if people accidentally get acne products in mouth, though should be avoided. Topical products shouldn't taste good, discouraging accidental ingestion. Sensory sensitivities, common in autism, sensory processing disorders, might affect product tolerability. Lightweight, minimally fragrant, smooth-textured products work better for sensory-sensitive individuals. Enjoyable sensory experience with skincare products increases likelihood of long-term compliance. Choosing products you enjoy using, good smell, nice texture, pleasant feel, supports routine adherence. Guide 81, Acne Recovery and Psychological Healing Post-Treatment. After achieving clear skin, psychological healing, moving past acne-related trauma, anxiety, or self-image damage, matters as much as physical healing. Cognitive reframing of acne experience recognizes acne as surmounted challenge rather than permanent identity. I had acne and overcame it differs from I am acne-prone in psychological impact. Rebuilding self-esteem after acne involves recognizing beauty and worth beyond skin appearance. Therapy or self-help work might support this. Managing residual anxiety about future acne recurrence is important. Some anxiety is adaptive, maintaining treatment compliance, but excessive worry isn't. Balance maintaining treatment with accepting that occasional breakouts don't mean failure. Celebrating clear skin and the journey to achieve it acknowledges the effort and success. This positive reinforcement supports continued treatment compliance. Relationships and social anxiety that develop during severe acne might persist even after clear skin. Gradual re-engagement in avoided activities supports recovery. Professional mental health support helps process acne-related psychological impact if significant trauma occurred. Guide 82, Acne and Climate Change, How Environmental Factors May Shift Acne Patterns. As climate changes, acne patterns and triggers might shift. Understanding climate-acne relationships helps anticipate these changes. Increasing temperatures in many regions mean more heat-driven acne. Sweat production increases with heat, increasing occlusion-related acne. Climate change's warming trend might increase acne prevalence. Increased humidity in some regions promotes bacterial growth and acne. Drier climates in other regions increase barrier compromise, contributing to acne. Increased air pollution from climate change effects worsens acne through oxidative stress and particle occlusion. Seasonal shifts might change acne seasonality patterns as climate changes. Increased stress from climate-related anxiety might affect acne through stress hormone pathways. Water quality changes from climate change might affect acne through different water exposure. While current climate change effects on acne are not yet clearly documented, these theoretical relationships suggest acne patterns might shift with climate. Being adaptable in acne management as environmental factors change is prudent. Guide 83, Acne in the Digital Age, Social Media, Online Communities, and Misinformation. Social media and online communities have transformed acne experience. Understanding digital age acne realities helps navigate benefits and pitfalls. Social media's focus on flawless appearance increases appearance anxiety and acne-related distress for some. Comparing yourself to filtered, edited images causes unrealistic expectations and self-esteem damage. Curated social media images where people show only their clearest skin days or use heavy filtering distort reality. Recognizing that everyone has imperfect skin days helps maintain perspective. Online acne communities provide support, shared experiences, and practical advice. These communities normalize acne and reduce isolation. Misinformation about acne spreads rapidly online. Evaluating source credibility and distinguishing evidence-based information from marketing or myth is important. Online acne forums sometimes feature unverified treatment claims. Being skeptical of anecdotal stories and seeking professional guidance for unusual claims protects you. Telemedicine dermatology accessed online expands access to professional care, beneficial for those without nearby specialists. Online skin analysis apps using AI might provide useful guidance but shouldn't replace professional assessment. Limiting social media exposure, particularly comparing images, supports mental health during acne treatment. Guide 84: Acne Treatment in Resource-Limited Settings. Many people globally lack access to standard acne treatments. Understanding available low-cost options and treatment adaptations helps those with limited resources. Over-the-counter benzoyl peroxide and salicylic acid are often affordable and available globally, even in resource-limited settings. These should be first-line treatments where available. Local botanical treatments, tea tree oil, neem oil, honey, used traditionally sometimes have evidence supporting their use. These are often affordable and locally available. Oral antibiotics, generic doxycycline, tetracycline, are often inexpensive in resource-limited settings, making oral antibiotic treatment accessible. Isotretinoin might be unavailable in many countries due to cost or regulatory restrictions, limiting treatment for severe acne without this option. Professional dermatology care might be unavailable or prohibitively expensive. Training non-specialist healthcare providers in basic acne treatment helps extend care availability. Comedogenic and occlusive, clogging pores and promoting acne. Oil acne is often quite severe if exposure is chronic. Chloracne results from exposure to chlorinated hydrocarbons in chemical manufacturing. This is rare, but when occurs, is severe. Chloracne is characterized by cystic acne and systemic symptoms from toxic chemical exposure. Prevention strategies for occupational acne include wearing protective equipment, gloves, long sleeves, face protection when possible, washing thoroughly at end-of-work shifts to remove chemicals from skin, changing out of contaminated clothing immediately, using workplace-provided safety measures and equipment, discussing with employers if exposures can be reduced or if different equipment can minimize exposure. Treating occupational acne while reducing exposures through workplace modifications is important. Standard acne treatments combined with occupational hygiene improvements provide best results. Workplace legal considerations matter if acne results from unsafe occupational exposures. In some jurisdictions, occupational skin diseases are covered under workers' compensation. Documenting occupational exposure history and acne onset can establish occupational causation. Guide 57: Asian Skin, Rosacea, and Acne in East Asian Populations. East Asian skin has specific characteristics affecting acne presentation and treatment response. Understanding these characteristics improves acne management in East Asian populations. East Asian skin often has different lipid composition and barrier characteristics compared to other populations. Some evidence suggests East Asian skin has higher ceramide content but different lipid organization, affecting both barrier function and acne development. Rosacea is increasingly recognized in East Asian populations, though historically was underdiagnosed. East Asian rosacea often presents as acne-like lesions, acne rosacea, potentially confused with bacterial acne. Recognizing rosacea as distinct from acne ensures appropriate treatment selection. Sebaceous gland characteristics may differ slightly across ethnic backgrounds, though individual variation exceeds group variation. Treatment intensity might require individualization based on individual skin characteristics rather than ethnic background. Post-inflammatory hyperpigmentation is very common in East Asian skin and requires aggressive prevention and treatment. Sun protection is particularly important. PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly relevant. Barrier function support might be particularly important for East Asian skin in certain climates. Adapting treatment intensity and moisturizing based on individual response rather than population averages is most accurate approach. Guide 58, Acne in LGBTQ+ populations, hormone therapy and transition-related acne. Transgender and non-binary individuals receiving hormone therapy often experience acne changes related to hormonal transition. Understanding these changes helps manage acne during transition. Testosterone-based hormone therapy, for transmasculine individuals, typically worsens acne initially due to increased androgens. Acne often develops or significantly worsens during the first 1 to 2 years of testosterone therapy. This is particularly challenging for individuals already prone to acne. Aggressive acne prevention and treatment during testosterone initiation is important. Some individuals benefit from starting acne treatment prophylactically before or as testosterone therapy begins. Estrogen-based hormone therapy, for transfeminine individuals, typically improves acne over time as androgens are suppressed. Many transfeminine individuals experience significant acne improvement within several months to a year of estrogen therapy. This improvement can be dramatic and psychologically significant. Spironolactone, commonly used alongside estrogen therapy for anti-androgen effects, has acne-beneficial effects. The combination of spironolactone plus estrogen provides maximal acne improvement in transfeminine individuals. Timeline for hormone therapy acne effects is important to understand. Acne worsening from testosterone therapy might persist 1 to 2 years before stabilizing or improving. Setting realistic expectations prevents discouragement during this period. Psychological impact of acne during transition deserves acknowledgement. Acne during transition, when someone is often already managing significant life changes and body image adjustments, can cause additional distress. Aggressive acne management acknowledges this psychological weight. Working with dermatologists and endocrinologists familiar with transgender health improves care. Some clinicians are specifically experienced in managing acne in hormone therapy contexts. Guide 59, Acne Prevention in Acne-Prone Individuals, True Primary Prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur. While this doesn't apply to those already experiencing acne, understanding prevention helps younger individuals or those with family history prevent severe acne. Risk factors for developing acne include family history, strong genetic component, male sex, higher baseline androgens, and adolescent/young adult age. Individuals with all 3 risk factors have highest acne development risk. Primary prevention strategies include skincare routines starting in early adolescence, gentle cleansing, sun protection, use of non-comedogenic products, education about acne triggers and prevention, stress management techniques learned early, healthy diet emphasizing whole foods, adequate sleep, limiting skin trauma, not picking at skin, avoiding aggressive products. Non-comedogenic product selection starting early prevents product-induced acne. Teaching teenagers to evaluate skincare products and cosmetics prevents years of unnecessary acne from products. Early intervention at first signs of acne prevents progression to severe acne. Starting mild treatments, salicylic acid cleanser, at the very first breakout often prevents acne from worsening. This early treatment is simpler than treating established severe acne. Preventing antibiotic resistance through early intervention with non-antibiotic treatments preserves antibiotic effectiveness if future antibiotics are needed. Starting with topical treatments rather than immediately jumping to oral antibiotics is prudent prevention approach. Education about acne myths prevents harmful behaviors. Teaching teenagers that acne results from poor hygiene, untrue, chocolate causes acne, unproven, or picking helps, false, prevents reinforcing these myths. Accurate education supports evidence-based prevention. Professional guidance for high-risk individuals might include dermatology consultation for those with strong family histories or early acne onset. Early professional involvement can prevent severe acne development. Guide 60, Acne Maintenance After Successful Treatment, the Forever Routine. Once you've achieved clear skin after acne treatment, maintaining clarity requires ongoing commitment to maintenance. Understanding long-term maintenance distinguishes between temporary acne control and permanent clear skin. The first principle of maintenance is recognizing that acne tendency doesn't disappear, it's managed. Your skin's predisposition to acne remains, but with appropriate ongoing treatment, acne stays controlled. This is similar to maintaining any chronic condition. You don't stop managing diabetes once blood sugar is controlled, you maintain management indefinitely. Maintenance routines are typically simpler than treatment routines. While treatment might involve multiple actives used frequently, maintenance often involves fewer treatments used less frequently. For example, someone might use salicylic acid daily and benzoyl peroxide daily during treatment, but maintain clear skin with just retinoid at night and benzoyl peroxide spot treatments as needed. Identifying essential treatments through your treatment experience guides your maintenance routine. Which treatments were crucial to your success? Continue those indefinitely. Which were helpful but not essential? Consider dropping these if your skin tolerates it, simplifying your routine while maintaining clarity. Seasonal adjustments remain important long-term. Winter might require slightly more moisturizing or reduced exfoliation frequency. Summer might require increased sun protection. These adjustments maintain skin health across seasons. Stress management, sleep, diet, and other lifestyle factors remain important long-term. While you might relax some during periods of stability, reverting entirely to poor habits causes acne recurrence. Maintaining reasonable health habits supports ongoing skin clarity. Monitoring your skin regularly allows early detection of potential recurrence. Monthly self-assessments identifying any new breakouts allows you to intensify treatment immediately if needed, preventing minor breakouts from progressing to significant acne. Having your dermatologist's contact information and willingness to contact them if acne recurs despite maintenance allows quick professional intervention. Don't try to solve recurrent acne alone for months, get professional help quickly. Keeping maintenance products on hand prevents running out and missing treatments due to product unavailability. Some people order backup products when current products are half empty, ensuring continuity. Reframing maintenance as self-care rather than burden improves adherence long-term. Your skincare routine is caring for your body's largest organ, supporting not just appearance but overall skin health and barrier function. The ultimate goal of maintenance is such consistency that skincare becomes automatic, habitual, and integrated into your daily routine like brushing teeth. At this point, maintaining clear skin requires minimal conscious effort. Guide 61: Understanding acne in specific sports and athletic activities. Different sports expose athletes to different acne triggers. Understanding sport-specific acne patterns allows targeted prevention and management for athletes. Swimming exposes skin to chlorine and often tight, non-breathable swimwear. Chlorine is drying and irritating, worsening acne. Frequent swimmers often experience acne on face, chest, and shoulders. Prevention includes rinsing thoroughly after swimming, removing chlorine quickly through gentle cleansing, using moisturizer afterward to combat dryness, and wearing clean, breathable clothing after swimming. Contact sports, football, wrestling, rugby, involve friction, pressure from equipment, and contact with other players' skin and bodily fluids. Helmet friction often causes severe acne along helmet edges. Prevention includes ensuring equipment is clean, using protective barriers, adhesive tape, where possible, showering immediately after contact, and maintaining aggressive acne treatment during the season. Running and jogging cause profuse sweating and friction from clothing. Prevention includes wearing moisture-wicking, breathable clothing, showering immediately after exercise, cleansing sweat off before acne develops, and using lightweight, non-comedogenic sunscreen resistant to sweat. Cycling involves friction from tight cycling clothing and helmet wear. Prevention strategies similar to other sports apply. Weightlifting and resistance training involve pressure from equipment, sweat, and friction. Focusing on cleanliness of equipment, showering immediately after workouts, and changing into clean clothes prevents sweat-related acne. Yoga and other activities with face-on-mat contact, yoga, Pilates, certain exercises, can cause acne if mats aren't clean. Using personal mats, washing them regularly, and avoiding touching your face during exercise helps. General athletic acne prevention across all sports includes showering within 1 to 2 hours after exercise, not wearing sweat-soaked clothing longer than necessary, cleansing face, neck, and areas covered by equipment, using clean towels, maintaining aggressive acne treatment during athletic seasons when acne tends to worsen. Working with dermatologists familiar with athletic acne helps develop sport-specific prevention and treatment plans. Some athletes benefit from temporary treatment intensification during seasons when their sport-specific acne triggers are highest. Guide 62: Acne treatment during immunosuppression and immune compromise. Immunosuppressed individuals, those with HIV, on immunosuppressive medications, with certain diseases, experience altered acne patterns and treatment responses. Managing acne in immunocompromised individuals requires special considerations. Severe acne with unusual presentations can indicate immune compromise in some contexts. If acne is unusually severe, doesn't respond to standard treatments, or has atypical features, immune status should be assessed. Immunosuppression can paradoxically worsen or improve acne depending on the specific immune alteration. HIV infection, particularly with low CD4 counts, is associated with worse acne and unusual presentations. Improving immune function through antiretroviral therapy often improves acne. Immunosuppressive medications, for transplant, autoimmune disease, or other conditions, sometimes worsen acne through various mechanisms. Managing acne in immunosuppressed individuals requires careful coordination with prescribers to avoid interactions and ensure appropriate acne treatment. Live bacterial vaccines are contraindicated in immunosuppressed individuals. This limits probiotic supplement options in severely immunocompromised people to non-viable probiotics, postbiotics, fermented foods. Isotretinoin should be used cautiously or potentially avoided in severely immunocompromised individuals due to risks of severe side effects and reduced healing capacity. However, isotretinoin can be used in mildly immunocompromised individuals with appropriate monitoring. Standard topical acne treatments are generally safe in immunocompromised individuals, though infection risk from acne or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs since prevention is often simpler than treatment. Guide 54: Drug-induced acne and medication side effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible or combining lithium with aggressive acne treatment might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrel, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. Iodine-containing supplements or medications can trigger acne. High-dose iodine supplementation is associated with acne worsening. This is one reason avoiding excessive iodine supplementation unless specifically indicated is prudent. Phenytoin, anti-seizure medication, and other older anti-seizure drugs can trigger acne or gingival hyperplasia, gum overgrowth. If these medications are necessary, managing side effects is required. When drug-induced acne is suspected, first confirm with your prescribing healthcare provider that the medication is likely the culprit. Assess whether alternative medications without acne side effects exist. If alternatives don't exist, combine the medication with aggressive acne treatment. Don't discontinue necessary medications without medical guidance even if acne worsens. Guide 55. Nutritional deficiencies and acne, zinc, vitamin D, selenium, and beyond. Certain nutritional deficiencies correlate with worse acne. Understanding which deficiencies affect acne allows you to assess your nutritional status and supplement if needed. Zinc deficiency is well established as correlating with worse acne. Zinc supports immune function, wound healing, and inflammation regulation, all relevant to acne. People with zinc deficiency have notably worse acne. Supplementing adequate zinc, 30 mg daily, often improves acne significantly if deficiency exists. However, supplementing when not deficient provides minimal additional benefit. Identifying zinc deficiency involves blood testing. However, zinc blood levels don't always accurately reflect total body zinc stores, making interpretation complex. If you suspect zinc deficiency, discussing blood zinc testing with your healthcare provider is reasonable. Vitamin D deficiency correlates with worse acne and increased inflammation. Vitamin D supports immune function and has anti-inflammatory effects. Many people, particularly those in northern climates or those who avoid sun exposure, have vitamin D deficiency. Supplementing vitamin D at 1000 to 400 IU daily improves acne in some individuals, particularly those with low baseline levels. Testing vitamin D status can help identify deficiency. Selenium deficiency affects immune function and skin health. Adequate selenium, 55 to 200 micrograms daily, supports skin health. However, acne-specific benefits of selenium supplementation aren't definitively established. Iron deficiency, particularly in menstruating women, can affect overall skin health and healing. Severe iron deficiency anemia causes various health problems including poor wound healing and immune dysfunction. However, iron supplementation for non-deficient people doesn't improve acne. Vitamin A, retinol, deficiency causes follicular hyperkeratinization and immune dysfunction contributing to acne. However, toxicity from excess vitamin A is also problematic. Getting adequate vitamin A through diet, liver, sweet potato, leafy greens, is ideal. Supplementing vitamin A is only necessary if deficient. B vitamins, particularly B5, pantothenic acid, are promoted for acne at very high doses, 10+ grams daily. However, evidence is weak and high-dose B5 causes diarrhea frequently. Normal B vitamin intake through diet or multivitamin supplementation supports general health without special acne benefits. Omega-3 fatty acid deficiency promotes systemic inflammation worsening acne. Getting adequate omega-3s, 1 to 2 grams EPA plus DHA daily from fish or supplements, supports skin health through inflammation reduction. Identifying nutritional deficiencies. Blood testing can assess status for most nutrients. Dietary assessment helps identify if diet provides adequate nutrients, considering supplementation if deficiencies are identified. However, supplementing without deficiency rarely provides additional benefit. Getting nutrients through food when possible is preferable to supplementation. Guide 56. Occupational acne syndromes, tar acne, oil acne, and chemical exposure. Workers in certain occupations experience acne specifically from occupational chemical exposures. Understanding occupational acne helps you implement prevention strategies and pursue appropriate treatment. Tar acne develops in workers exposed to coal tar, crude oil, and petroleum products. Mechanics, road workers, and petroleum industry workers are susceptible. Tar acne results from follicular occlusion and irritation from these substances. Appearance is often on exposed areas, hands, face, neck, forearms. Oil acne develops in workers exposed to mineral oils and cutting fluids in metalworking, critically affected by anabolic steroids, which cause severe acne, through testosterone suppression effects, though acne treatment itself doesn't affect male fertility. Untreated severe acne might indirectly affect fertility through mental health impacts and reduced relationship satisfaction. Treating acne supports fertility planning outcomes. Guide 96. Acne and alcohol use, interactions and effects. Alcohol affects acne through multiple mechanisms. Understanding these relationships helps you make informed alcohol decisions. Alcohol increases inflammation and dehydration, both worsening acne. Excessive alcohol consumption notably worsens acne in most people. Alcohol consumption patterns matter. Occasional moderate alcohol probably has minimal skin effects. Chronic excessive consumption significantly worsens acne. Some acne medications interact with alcohol. Isotretinoin with alcohol increases liver toxicity risk. Antibiotics with alcohol sometimes cause nausea and reduced effectiveness. Alcohol increases cortisol and stress, indirectly worsening acne through hormonal pathways. Alcohol disrupts sleep quality, indirectly worsening acne through sleep deprivation effects. Dehydration from alcohol increases skin dehydration, contributing to compensatory sebum production and acne. For optimal acne management, minimizing alcohol consumption is beneficial. This doesn't require complete abstinence for most people, but reducing consumption supports acne improvement. Guide 97. Acne and smoking, direct and indirect effects on skin. Smoking worsens acne through multiple mechanisms, making smoking cessation valuable for acne improvement. Smoking increases inflammation systemically, promoting acne. Smokers have higher acne prevalence than non-smokers. Smoking impairs immune function, reducing your body's ability to fight acne-causing bacteria. Smoking impairs wound healing, increasing scarring risk from acne lesions. Smoking damages skin barrier function, increasing irritation and acne risk. Secondhand smoke exposure, while less harmful than direct smoking, also worsens acne through similar mechanisms. Smoking interferes with many acne medications. Some medications have reduced effectiveness in smokers. Smoking accelerates skin aging, creating double damage, worse acne plus premature aging. Smoking cessation, beyond its general health benefits, often improves acne significantly. Many former smokers notice acne improvement within weeks to months of quitting. For optimal acne management, smoking cessation is highly beneficial if applicable. Conclusion: your acne treatment journey. Congratulations on completing this comprehensive 100-guide exploration of acne science, treatment, and management. You now possess extensive knowledge spanning from basic acne biology through emerging treatments and personalized optimization strategies. Remember these core principles as you move forward. 1. Acne is treatable. Whatever your acne severity, treatment exists. You can achieve clear skin. 2. Consistency matters more than perfection. Maintaining a routine 90% of the time beats perfect adherence for 2 months than abandonment. 3. Your acne is unique. Treatments that work for others might not work for you, and vice versa. Personalizing based on your response is important. 4. Professional help is valuable. Dermatologists can identify problems you might miss, recommend optimal treatments, and provide professional therapies beyond home care. 5. Mental health is legitimate. Acne's psychological impact is real. Addressing it matters as much as treating physical acne. 6. Lifestyle factors matter. Sleep, stress, diet, and exercise significantly affect acne. Optimizing these supports treatment success. 7. Early intervention prevents complications. Treating acne promptly prevents severe acne and scarring that would result from delayed treatment. 8. Long-term maintenance matters. Achieving clear skin isn't the finish line. Maintaining clarity requires ongoing appropriate management. Your acne journey is unique to you. Some people achieve clear skin with simple topical treatments. Others require comprehensive professional management, including systemic medications. Both paths lead to clear skin. Whether you're just starting acne treatment, struggling with treatment-resistant acne, or maintaining achieved clarity, you now have comprehensive knowledge to guide your path forward. Clear skin is achievable. Your dedication to understanding your acne and implementing appropriate treatment will lead you there. Best wishes on your acne-free future, potentially safe during pregnancy. Topical salicylic acid used in small amounts and limited areas. Large-scale systemic absorption possible though typically minimal. Topical azelaic acid, generally considered safe. Topical clindamycin. Some dermatologists recommend avoiding though others consider it relatively safe. Sulfur-based products, considered relatively safe historically. Most conservative approach during pregnancy, gentle cleansing only, avoiding all active acne treatments unless absolutely necessary. Many dermatologists recommend waiting to treat acne aggressively until after pregnancy or after breastfeeding concludes if planning to breastfeed. If acne must be treated during pregnancy due to severity or psychological impact, consultation with both your obstetrician and dermatologist ensures treatments are appropriately selected based on risk-benefit analysis specific to your pregnancy. Sometimes treating severe acne is justified despite medication risks if the psychological impact is severe. Post-pregnancy acne sometimes occurs as hormones shift after delivery. Many women tolerate this temporary worsening with the knowledge it typically resolves within months. Breastfeeding considerations. Most topical acne treatments are safe during breastfeeding as systemic absorption is minimal. However, discussing specific medications with your healthcare provider ensures safety. Postpartum hormonal changes sometimes improve acne that was severe during pregnancy. This improvement can be psychologically significant after months of acne during pregnancy. Planning for pregnancy if you're on acne medications like isotretinoin requires stopping several months before conception. Discuss with your dermatologist if planning pregnancy. Guide 67, Acne in Adolescence, Age-Specific Management and Developmental Considerations. Adolescent acne requires understanding both the physiological changes driving acne and the psychological sensitivities of adolescence. Age-appropriate management optimizes outcomes and builds healthy skin habits for adulthood. Puberty triggers the hormonal changes driving typical adolescent acne. Androgens surge during puberty. Recurrent acne after previous isotretinoin course might be retreated with isotretinoin, though some dermatologists reserve retreatment for specific circumstances. The process of obtaining isotretinoin involves consultation with a dermatologist willing to prescribe it, understanding all requirements and side effects, baseline laboratory testing, and enrollment in 𝑦𝒂𝒄𝒆. For women, establishing contraception plan is necessary. Once established on isotretinoin, compliance with monthly visits and laboratory tests is mandatory. Noncompliance results in treatment discontinuation. Cost is a consideration. Isotretinoin itself is relatively inexpensive. The original brand Accutane is expensive, but generic isotretinoin is affordable. However, the required monthly visits and laboratory tests add significant cost. Insurance typically covers isotretinoin for severe acne, but coverage varies. Discussing cost with your dermatologist before starting is important. Results from isotretinoin are remarkable. Most patients experience dramatic acne improvement within 1 to 2 months, with near-complete clearance by 3 to 4 months. The persistence of results years after treatment completion is what makes isotretinoin special. Most other treatments require ongoing use for results to persist. Post-isotretinoin skin care involves using gentle products, as skin is often more sensitive after treatment. Many patients can use minimal skin care after isotretinoin, though some benefit from occasional retinoid maintenance to prevent any acne recurrence. Most patients can essentially stop acne-focused skin care and use only basic skin care and sunscreen. Isotretinoin should not be your first treatment. Attempting appropriate topical treatments, salicylic acid, benzoyl peroxide, retinoids, and potentially oral antibiotics for several months should precede isotretinoin consideration. However, if you have severe acne causing scarring risk or significant distress, don't suffer for years without considering isotretinoin. Discuss it with your dermatologist if you have severe, resistant acne. Guide 22, Oral Antibiotics for Acne, Types, Mechanisms, Resistance, and Long-Term Management. Oral antibiotics have been acne treatment staples for decades, effectively controlling moderate to severe inflammatory acne. Understanding antibiotic options, their effectiveness, the critical issue of antibiotic resistance, and appropriate usage patterns is essential for optimal acne treatment. Oral antibiotics treat acne through multiple mechanisms. First, they kill Cutibacterium acnes bacteria, reducing bacterial colonization in follicles. Second, at acne-treating doses, they have significant anti-inflammatory effects beyond their antibacterial properties. Third, they can reduce lipase production, an enzyme that increases sebum irritancy, decreasing acne inflammation. The combination of these effects makes antibiotics highly effective for inflammatory acne. Doxycycline is the most commonly prescribed oral antibiotic for acne. It's effective, relatively inexpensive, and generally well tolerated. Typical dosing is 100 mg once or twice daily. Doxycycline has additional anti-inflammatory effects beyond its antibacterial action, partly explaining its effectiveness for acne. However, doxycycline has notable drawbacks. It can cause photosensitivity, sun sensitivity, so strict sunscreen use is essential during treatment. It can cause esophageal irritation if not taken properly, requiring taking it upright with significant water and not lying down for 30 minutes afterward. Some women experience vaginal yeast infections due to disruption of normal bacterial flora. Birth control pill effectiveness can be reduced by doxycycline in some individuals, requiring backup contraception. Minocycline is an alternative tetracycline antibiotic with similar effectiveness to doxycycline. It's lipophilic, fat-soluble, allowing it to penetrate sebaceous glands well. Minocycline can cause blue discoloration of skin and mucous membranes with long-term use. While this is reversible upon discontinuation, it's an undesirable potential side effect. Minocycline also has slightly higher risks of drug-induced lupus and autoimmune hepatitis compared to doxycycline, though these are rare. Many dermatologists now prefer doxycycline over minocycline due to these considerations. Azithromycin is a macrolide antibiotic sometimes used for acne. It's taken at lower doses than typical infection-treating doses, 250 mg 3 times weekly. Azithromycin has strong anti-inflammatory effects. However, Cutibacterium acnes resistance to azithromycin is increasingly common, making it less reliable than tetracyclines. Azithromycin is often reserved for patients who cannot tolerate tetracyclines. Trimethoprim sulfamethoxazole, TMPSMX, is a combination antibiotic occasionally used for acne, particularly in patients who cannot tolerate tetracyclines. However, it's less effective than tetracyclines and has higher allergy rates, limiting its use. Combining retinoids with other acne treatments provides advanced results. After retinoid tolerance is established, typically 8 to 12 weeks, carefully introducing benzoyl peroxide on different days, perhaps retinoid at night, benzoyl peroxide in the morning or on different evenings, can enhance overall acne control. However, this requires careful management. Combining retinoids with strong treatments too early in the process causes excessive irritation. Wait until you're using retinoids nightly without significant irritation before attempting combination with benzoyl peroxide. Combining salicylic acid with retinoids requires similar caution. Both are exfoliating and somewhat irritating, so combining them immediately is unwise. After 8 to 12 weeks of stable retinoid use with good tolerance, you might use salicylic acid cleanser in the morning and retinoid at night. The salicylic acid provides daytime exfoliation and sebum control, while retinoid provides nighttime cellular turnover and anti-inflammatory benefits. Oral antibiotics plus retinoids represent an advanced combination for moderate inflammatory acne. The antibiotic controls bacterial inflammation while the retinoid addresses cellular turnover and sebaceous gland normalization. This combination is particularly effective for acne resistant to topical treatments alone. However, careful introduction is necessary. If possible, allow 4 to 8 weeks of antibiotic therapy before introducing retinoids, then start retinoids at low frequency and concentration. Hormonal treatments combined with topical treatments represent a synergistic approach for hormonal acne in women. Oral contraceptives or spironolactone address the hormonal root cause, while topical treatments manage surface acne manifestations. This combination often provides superior results to either approach alone. For example, a woman might be on spironolactone plus doxycycline plus benzoyl peroxide, addressing hormone regulation, bacterial factors, and inflammation simultaneously. Chemical peels combined with home treatments provide enhanced results. Monthly superficial chemical peels combined with daily topical acne treatments provide more dramatic results than either approach alone. The chemical peel removes surface impurities and promotes cellular turnover, while daily treatments maintain and enhance the peeling results. Vitamin C plus niacinamide represents a complementary antioxidant combination that doesn't directly treat acne but provides skin-supportive benefits. Both are non-irritating and well tolerated together. Apply vitamin C in the morning for antioxidant protection, and niacinamide can be included in morning or evening moisturizers. These support overall skin health during active acne treatment. Important principles for combination therapy. Never introduce multiple new treatments simultaneously. If you want to combine treatments, introduce them sequentially. Establish tolerance to one treatment before adding another. Laser treatments require careful consideration for darker skin types. Many traditional lasers carry higher complication risk in darker skin, including post-inflammatory hyperpigmentation and depigmentation. Lasers specifically designed for darker skin types or lower fluence approaches are preferable. This is one area where working with dermatologists experienced in treating darker skin types is particularly important. Cultural attitudes toward acne and appearance affect treatment seeking and treatment consistency. Some cultures have strong stigma around acne, while others are more accepting. Understanding your cultural context and how it affects your response to acne helps manage psychological impact. Genetic predisposition to acne varies somewhat across ethnic backgrounds. Some populations have higher acne prevalence, though individual variation is substantial and environmental factors play large roles.
第2幕、裁きの重み。店は、上品な書で、菊と書かれた控えめな木製の看板で姿を現した、菊の花。𝑭𝒂𝒄𝒆はその入り口の前に立っていた。蜂蜜色の木で作られた引き戸からは、高級感と特別感が静かに伝わってくる。障子越しには、朝の仕込みの音がかすかに聞こえた、まな板を叩く包丁のリズム、水が流れる音、鋼同士がぶつかる金属音。彼は到着の時間を入念に計った、午前10時47分。朝食の片付けが終わり、昼の準備に取り掛かるその狭間は、厨房が人手の必要を見極める絶妙なタイミングだ。引き戸を開ける彼の手は、わずかに震えていた。いらっしゃいませ。奥から自動的に声がかかり、慌ただしい足音が続いた。真新しい着物を着た若い女性が現れ、笑顔で迎えかけたが、ＫＯＯの姿を見るとその笑みが一瞬で曇った。あ、すみません、おじさん。彼女は高齢の男性に使う砕けた呼び方でそう言った。それはＫＯＯの胸に小さな刃のように突き刺さった。お昼の営業は正午からなんです。求人の件で来ました。ＫＯＯは声を乱さずに答えた。厨房スタッフの募集です。彼女の目は、擦り切れたカーディガン、年齢を感じさせる手、わずかに前かがみになった背中を素早く見回した。あ、少々お待ちください。彼女は奥へ引っ込み、ＫＯＯは玄関先に配達員のように取り残された。店内は本気度を物語っていた。ヒノキの一枚板でできた長いカウンターは、すべての席が寸分の狂いもなく配置されている。カウンターの奥では厨房が輝いていた。磁気ストリップに並んだドイツ製の包丁、光を反射して小さな太陽のように輝く銅鍋。しつらえは現代的でありながら伝統への敬意を忘れていない若い世代がネオ懐石と呼ぶスタイルだ。何の用だ？ 威厳を含んだ声が空気を切った。厨房から男が現れた。35歳くらいだろうか、白衣は刃物のようにパリッとしている。シェフㄔ𝒂𝒄𝒊𝒂𝒍はおしゃれに傾けられ、両腕には真剣に厨房を渡り歩いてきたことを物語る火傷と傷跡が刻まれていた。これが、この店の料理長なのだろ
う。Guide 41, Microneedling RF and Advanced Microneedling Technologies for Acne Scarring. Advanced microneedling technologies combine traditional microneedling with additional energy sources or techniques for enhanced results in acne scar treatment. Understanding these advanced options helps you select appropriate professional treatments. Radiofrequency, RF, microneedling combines microneedling with radiofrequency energy delivered through the needles. As needles penetrate skin, they deliver RF energy at depth, providing enhanced collagen stimulation compared to standard microneedling. The combination approach produces more dramatic results but with more significant post-treatment appearance changes. Recovery involves 5 to 7 days of significant redness and swelling compared to 3 to 5 days for standard microneedling. Microneedling depth significantly affects results and recovery. Shallow microneedling, 0.5 mm, primarily addresses surface concerns with minimal downtime. Medium depth, 1 to 1.5 mm, addresses scarring moderately with moderate downtime. Deep microneedling, 2.0 to 2.5 mm, addresses severe scarring most effectively but with significant recovery time and complication risks. Your practitioner determines appropriate depth based on scar severity and recovery tolerance. Fractional microneedling treats portions of skin rather than entire areas, leaving some skin untouched for faster healing. This approach provides good scar improvement with reduced downtime compared to full-face treatment. Multiple sequential treatments spaced 4 to 6 weeks apart provide cumulative improvements superior to single treatments. Most scar improvement appears over 3 to 6 months following each treatment as collagen remodels. Treatment plans typically involve 3 to 6 sessions. Post-treatment care optimizes results. Aggressive sun protection, SPF 50+, daily application, reapplication every 2 hours outdoors, is crucial during recovery. Healing serums with growth factors support skin recovery. Avoiding active ingredients during recovery week allows skin barrier to heal. Resuming actives cautiously after recovery supports ongoing improvement. Combining microneedling with other scar treatments, subcision, fillers, laser, often provide superior results to any single approach. Your dermatologist can recommend appropriate combinations for your specific scars. Guide 42, Emerging Probiotic and Postbiotic Skincare Research. Probiotic and postbiotic skincare represents an emerging frontier addressing acne through microbiome support. Understanding this emerging field helps you evaluate whether these approaches might benefit your skin. Topical probiotics contain live bacteria applied to skin. While the colonization potential of topical probiotics on skin is limited, skin has established microbiota that resists colonization. These products may provide benefit through bacterial metabolites and immune stimulation. Some evidence suggests certain probiotic strains reduce acne severity modestly. Postbiotics are metabolites produced by bacterial fermentation, essentially the waste products of probiotics with bioactive properties. Postbiotic serums contain these metabolites without live bacteria, avoiding stability and colonization concerns of live probiotics. Postbiotics show promise for reducing inflammation and supporting skin barrier. Fermented ingredients, products where plant ingredients have been fermented by beneficial bacteria, provide postbiotic-like benefits. These fermented products often have enhanced stability and penetration compared to non-fermented counterparts. Evidence for probiotics and postbiotics remains emerging rather than definitively proven. While some studies show modest benefits, high-quality large studies are limited. Probiotic and postbiotic skincare can supplement other treatments but shouldn't replace proven acne therapies. Quality matters significantly for probiotic products. High-quality products with documented effective strains are preferable to low-quality options. However, quality doesn't guarantee personal benefit. Guide 43: Artificial Intelligence and Personalized Acne Treatment. Artificial intelligence is beginning to transform dermatology through skin analysis and personalized treatment recommendations. Understanding these tools helps you evaluate whether AI-guided approaches might supplement your dermatology care. Reframing skincare as health maintenance rather than beauty obligation increases motivation for some people. Viewing skincare as caring for your body's largest organ similar to exercising or eating well helps maintain consistency even when acne is controlled. Celebrating milestones and achievements maintains motivation. Reaching certain milestones, 8 weeks of consistent routine, first month of clear skin, appearance-related anxiety helps reframe negative thoughts about acne, reducing anxiety and depression related to appearance. Specialized dermatology (CBT) combines skin condition understanding with psychological techniques for optimal outcomes. Acceptance and Commitment Therapy (ACT) helps people accept current skin status while committing to valued activities despite appearance concerns. This approach reduces appearance-focused anxiety while maintaining motivation for treatment. Body image work addressing distorted thinking about appearance supports mental health alongside medical treatment. Body dysmorphic disorder screening is important for those with disproportionate appearance distress. Mindfulness practices reduce appearance-focused anxiety and rumination, supporting mental health during treatment. Dermatology apps using AI analyze skin photos to assess acne severity, identify acne types, and recommend treatments. While some apps show reasonable accuracy for basic assessments, they can't match professional dermatologists for complex cases. These apps serve best as supplements to professional care rather than replacements. Accuracy of AI skin analysis varies. Higher quality apps with larger training datasets and professional validation generally perform better than those lacking proper development. However, all AI assessments have limitations and should be verified by professionals. Personalization algorithms use your skin characteristics, responses to past treatments, and various data points to recommend optimized treatment approaches. As these systems improve and accumulate more treatment outcome data, personalization effectiveness likely improves. Currently, these tools remain supplements to professional judgment rather than replacements. Telemedicine AI-assisted dermatology allows remote consultations where AI supplements the dermatologist's assessment. This can improve access to dermatology for people without nearby specialists. Privacy considerations are important with AI skincare apps. Your skin data is sensitive. Understanding how your data is used and stored matters when choosing AI tools. Guide 44: Peptide Therapies and Bioidentical Hormone Treatments. Advanced peptide therapies and bioidentical hormone treatments represent frontier approaches for acne management. Understanding these options helps you discuss them with your healthcare provider. Specific peptides stimulate collagen production and support skin barrier healing. For acne management, peptides primarily support post-acne recovery and scar treatment rather than treating active acne directly. Peptides appear in many premium skincare products. Bioidentical hormone replacement therapy, BHRT, uses hormones chemically identical to your body's natural hormones. For hormonal acne, bioidentical estrogen and progesterone might theoretically provide benefits similar to synthetic hormones in oral contraceptives with theoretically better tolerability. However, evidence for BHRT's superiority for hormonal acne is limited. Additionally, BHRT is more expensive and requires more individualized monitoring than standard hormonal contraceptives. Compounded bioidentical hormone prescriptions allow customization of hormone dosing and ratios. For severe hormonal acne, compounded BHRT might be appropriate, though professional oversight is essential. Guide 45. Nanotechnology in acne treatment. Nanotechnology enables delivery of active ingredients at microscopic scale for potentially enhanced effectiveness. Understanding nanodelivery systems helps you evaluate next-generation acne products. Liposomal formulations encapsulate active ingredients in microscopic lipid spheres, enabling enhanced penetration and stability. Liposomal retinol or liposomal benzoyl peroxide potentially provide enhanced effectiveness with reduced irritation through optimized delivery. Products using liposomal technology are increasingly available commercially. Nanoparticles of active ingredients increase surface area and bioavailability, potentially enhancing effectiveness. Nano-sized acne actives are being researched for enhanced skin penetration and efficacy. Sustained-release nanotechnology enables gradual release of actives over extended periods, potentially maintaining consistent therapeutic levels with less frequent application. Guide 46. Environmental and climate adaptation strategies for acne. Acne management must adapt to different climates and environmental conditions. Understanding climate-specific strategies optimizes treatment across varying conditions. Tropical climates with heat and humidity increase sebum production and bacterial growth. Strategies include more frequent cleansing, lighter formulations, focus on oil control, increased sun protection. Sun worsens heat-related acne, air conditioning when possible, and increased frequency of active acne treatments. Guide 50. Acne success stories, effective patterns, and realistic timelines for clear skin. Examining successful acne treatment patterns and realistic timelines helps set expectations and maintain motivation during treatment journeys. Most people achieve significant acne improvement, 70 to 80% clearing, within 12 weeks with appropriate treatment. Complete clearance often takes 4 to 6 months. Severe acne or scarring might require 6 to 12 months or longer. Successful patterns often involve early professional intervention for moderate severe acne, combination approaches addressing multiple acne factors, consistent routine adherence, lifestyle optimization alongside treatments, patience through initial adaptation phases, and adjustment of treatments based on response. Common obstacles in achieving success include unrealistic expectations for overnight results, giving up after 4 to 6 weeks before full benefits appear, switching treatments too frequently before adequate trial period, neglecting lifestyle factors, inconsistent treatment adherence, and failing to pursue professional help when home treatment insufficient. Inspiring success often involves recognizing that clear skin is achievable through consistent, appropriate treatment. Most acne-prone individuals can achieve clear or nearly clear skin through proper dermatological care combined with appropriate skincare and lifestyle optimization. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties. 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involves Guide 1, Complete Understanding of Acne, Pathophysiology, Types, and Root Causes. Acne is one of the most prevalent skin conditions affecting approximately 85% of people aged 12 to 24, with significant numbers also experiencing adult acne. To effectively treat acne, you must first understand its underlying mechanisms and various manifestations. Acne develops through a complex process involving 4 primary factors: increased sebum production, follicular hyperkeratinization, colonization by Cutibacterium acnes bacteria, and inflammation. The sebaceous glands, which produce sebum or skin oil, become hyperactive primarily due to hormonal stimulation. During puberty, androgens like testosterone trigger increased sebum production. This oil production is essential for skin protection, but excess sebum creates an environment conducive to acne development. The sebaceous glands have androgen receptors, meaning individuals with heightened sensitivity to hormones or with hormonal imbalances experience excessive sebum production. Follicular hyperkeratinization refers to the abnormal shedding of skin cells lining the hair follicle. Normally, dead skin cells shed and exit through the hair follicle to the skin surface. In acne-prone individuals, these cells stick together and don't shed properly, creating a plug within the follicle. This plug, combined with sebum, forms an ideal environment for bacterial growth and acne formation. Cutibacterium acnes, previously known as Propionibacterium acnes, is a naturally occurring bacterium on human skin. However, in the oxygen-poor environment created by plugged follicles, this bacterium proliferates rapidly. These bacteria produce enzymes and toxins that trigger the immune system, causing inflammation and the visible acne lesions you see on your skin. Inflammation is the final component and arguably the most visible aspect of acne. When the immune system responds to bacterial presence and follicle rupture, it sends inflammatory cells to the area, causing redness, swelling, heat, and the formation of pustules or nodules. Understanding this process is crucial because different acne treatments target different components of this mechanism. There are numerous acne types, each requiring different treatment approaches. Non-inflammatory acne includes blackheads and whiteheads. Blackheads, or open comedones, form when a follicle is clogged with sebum and dead skin cells, but the pore remains open. The dark appearance results from oxidation of the sebum, not dirt. Whiteheads, or closed comedones, occur when the follicle is completely sealed, trapping sebum and dead cells beneath the skin surface, creating a small white or flesh-colored bump. Inflammatory acne is more noticeable and potentially scarring. Papules are small, firm, red bumps without a visible center, representing the body's inflammatory response. Pustules are similar to papules but contain a visible yellow or white center filled with pus. These are the classic pimples most people recognize. Nodules are larger, deeper, solid lesions that develop when inflammation extends deeper into the skin. They're typically painful and can last for weeks. Cystic acne represents the most severe form, where large, fluid-filled lesions develop deep within the skin. These are extremely painful and highly prone to causing permanent scarring. Several factors contribute to acne development beyond just hormones and bacteria. Genetics play a significant role. If your parents had severe acne, you're more likely to experience it too. Environmental factors matter considerably. Living in humid climates can exacerbate acne due to increased moisture promoting bacterial growth. Pollution and environmental toxins can clog pores and trigger inflammation. Stress hormones like cortisol increase sebum production and inflammation, explaining why acne often worsens during stressful periods. Diet influences acne more than previously thought. High glycemic foods rapidly spike blood sugar, causing insulin surges that trigger sebaceous gland stimulation and androgen production. Dairy products, particularly skim milk, contain hormones and proteins that may trigger acne in susceptible individuals. Omega-3 fatty acid deficiency promotes inflammation, while excessive omega-6 consumption without sufficient omega-3s creates an inflammatory imbalance. Certain medications, including corticosteroids and lithium, are known to trigger or worsen acne as a side effect. Recognizing your specific acne type and identifying contributing factors is the first step toward effective treatment. Some people have purely hormonal acne, while others struggle with bacterial acne, dietary triggers, or environmentally influenced breakouts. Understanding your personal acne profile allows you to select treatments targeting your specific problem rather than wasting time and money on ineffective solutions. Guide 2: Comprehensive Daily Cleansing and Preparation Routine for Acne-Prone Skin. The foundation of any successful acne treatment regimen is an appropriate cleansing routine. Many people underestimate the importance of proper cleansing, believing that any soap will suffice. However, for acne-prone skin, the cleansing process is far more nuanced and critical to success. Your cleansing routine will prepare your skin for treatment products and remove substances that promote acne formation. Begin by understanding that you should cleanse your face twice daily, once in the morning and once at night. Morning cleansing removes the oil, dead skin cells, and bacteria that accumulate overnight while you sleep. Your skin is active at night, producing more sebum and shedding dead cells, so morning cleansing is not optional. Evening cleansing is equally important, removing makeup, environmental pollutants, dirt, excess oil, and dead skin cells accumulated throughout the day. Many people neglect evening cleansing or do it hastily, significantly compromising their acne treatment results. Temperature matters more than most people realize. Always use lukewarm water, never hot water. Hot water strips away your skin's natural oils and disrupts the skin barrier, leading to increased irritation and compensatory sebum overproduction. Excessively hot water also causes blood vessel dilation, temporarily increasing inflammation and making acne appear worse. Conversely, cold water doesn't effectively remove oil and impurities, leaving your skin inadequately cleansed. Selecting an appropriate cleanser is crucial. For acne-prone skin, choose a gentle, pH-balanced cleanser specifically formulated for this skin type. The pH of your skin is approximately 4.5 to 5.5, slightly acidic. Using alkaline soaps disrupts this pH balance, damaging your acid mantle and increasing sensitivity and bacterial overgrowth. Look for cleansers labeled pH balanced or for acne-prone skin. Many quality acne cleansers contain salicylic acid, a beta-hydroxy acid that penetrates into pores to dissolve sebum and dead skin cells. A concentration of 0.5% to 2% is appropriate for daily cleansing. Some people prefer cleansers with benzoyl peroxide, which kills acne-causing bacteria. A 2.5% benzoyl peroxide cleanser is effective without excessive drying when used in a cleansing format rather than as a leave-on treatment. Others prefer gentle, fragrance-free cleansers without active ingredients, particularly if their skin is sensitive or if they're using other strong acne treatments. Experiment to find what works best for your skin, understanding that what works for your friend may not work for you. The cleansing process itself requires attention to technique. Wet your face thoroughly with lukewarm water to open your pores slightly and soften your skin. Apply your cleanser using your fingertips or a soft washcloth. Using your hands is often preferable because you have better control and can feel whether you're applying too much pressure. Gently massage the cleanser into your skin using circular motions for approximately 30 to 45 seconds. This duration gives the cleanser time to dissolve oil and loosen impurities without overstripping your skin. Pay special attention to your T-zone, your forehead, nose, and chin, where sebum production is typically highest. However, don't neglect other areas, particularly your jawline and cheeks where hormonal acne often appears. Be especially gentle around your eyes and lips where skin is thinner and more sensitive. Never use a rough scrub or washcloth, as physical abrasion can irritate acne lesions, spread bacteria, and increase inflammation. After thoroughly massaging, rinse your face completely with lukewarm water. Ensure you remove all cleanser residue, as leftover cleanser can irritate your skin and interfere with the absorption of treatment products. Pat your face gently dry with a clean, soft towel. This is important. Never rub your face dry aggressively. Aggressive rubbing irritates inflamed acne, increases inflammation, and can spread bacteria to other areas of your face or trigger acne. The ingredients matter significantly. Lightweight hydrating ingredients like hyaluronic acid, glycerin, and humectants hydrate without being occlusive or pore clogging. Niacinamide hydrates while also having acne-fighting properties. Centella asiatica, SICA, soothes irritation and supports skin barrier function. Ceramides strengthen your skin barrier, which is particularly important when using strong acne treatments. Avoid heavy oils and butters if you have acne-prone skin. Coconut oil, shea butter, and petroleum jelly can clog pores in susceptible individuals. However, some facial oils specifically designed for acne-prone skin can be beneficial. Jojoba oil, squalane oil, and rosehip seed oil are lightweight and non-comedogenic for most people. If you choose to use facial oil, use sparingly, just a few drops mixed into your moisturizer or applied as the last step of your routine. Texture matters when choosing a moisturizer for acne-prone skin. Lightweight gels absorb quickly and won't leave your skin feeling greasy. Hydrating lotions provide more hydration than gels while still being lightweight. Creams are heavier but may be necessary during winter or if your skin is severely dry from acne treatments. Everyone's needs are different. Experiment to find what works for you. Application technique is important. Apply moisturizer to slightly damp skin immediately after cleansing or applying treatments. This allows the moisturizer to lock in hydration from the water on your skin. Use about a quarter-sized amount for your entire face. Warm it between your palms, then gently press it into your skin using your fingertips. Don't rub or massage aggressively, as this can irritate acne lesions. Daytime and nighttime moisturizing might differ. During the day, use a lightweight gel or lotion moisturizer that won't make your skin feel greasy under makeup or throughout the day. Many people use a sunscreen as their daytime moisturizer since sunscreen provides hydration and protection simultaneously. At night, you can use a slightly richer moisturizer if desired, though many people use the same moisturizer day and night. If your skin is very dry from acne treatments, you might use the layering or sandwich method. Apply your treatment, retinoid, benzoyl peroxide, salicylic acid, wait 20 minutes, apply moisturizer, wait a few minutes, then apply another thin layer of moisturizer. This significantly reduces irritation and dryness while maintaining treatment efficacy. In winter or dry climates, increase moisturizing frequency or richness. You might apply moisturizer twice daily or use a richer nighttime formula. Some people add a facial oil, just a few drops, over their moisturizer for extra hydration during very dry periods. In summer or humid climates, you might reduce moisturizer richness, using only a lightweight gel. If your skin is extremely oily and acne-prone, you might feel you don't need moisturizer. However, most very oily skin is actually dehydrated. The skin is overproducing oil to compensate for internal dehydration. Using a lightweight hydrating moisturizer often actually reduces oil production by satisfying your skin's hydration needs. Sunscreen functions as both protection and moisturizer. Many quality sunscreens for daily use include hydrating ingredients. Use a sunscreen as your daytime moisturizer, applying it after your morning skincare routine and before makeup. Reapply every 2 hours if you'll be in the sun, or use a sunscreen powder for convenient reapplication over makeup. Hydrating masks once or twice weekly provide intense hydration supplementing your regular moisturizer. Sheet masks or cream masks with hydrating ingredients like hyaluronic acid, glycerin, or honey can be applied for 10 to 20 minutes, then removed. This boosts hydration without requiring daily changes to your routine. It's possible to over-moisturize. Applying excessive amounts or using too rich formulas can clog pores and worsen acne. Use appropriate amounts, about quarter-sized for your face, and choose formulations suitable for your skin type. If your acne worsens after starting a new moisturizer, discontinue it and try a different product rather than assuming moisturizer itself is the problem. Guide 11. Sun protection and UV damage prevention for acne-prone and treated skin. Sun protection is non-negotiable for anyone with acne or using acne treatments, yet it's frequently neglected. Understanding UV damage, sunscreen types, and proper application is essential for protecting your skin from damage while treating acne. UV radiation from the sun damages skin through multiple mechanisms. UVB rays cause sunburn and skin cancer. UVA rays penetrate deeply, causing aging, wrinkles, and skin cancer. Both types of UV radiation increase inflammation, which worsens acne. Additionally, UV exposure causes post-inflammatory hyperpigmentation, dark marks remaining after acne heals, to darken significantly and persist longer. Without sun protection, acne marks that might fade within 3 to 4 months can persist for a year or longer. Many acne treatments increase photosensitivity, making skin more susceptible to sun damage. Retinoids significantly increase UV sensitivity. Salicylic acid and benzoyl peroxide cause mild photosensitivity. Chemical exfoliants, AHAs, BHAs, increase sun sensitivity. Vitamin C also increases sensitivity in some formulations. Using any of these treatments without sun protection significantly increases sun damage risk and post-inflammatory hyperpigmentation. Sunscreen comes in 2 main types: mineral, physical, and chemical. Mineral sunscreens contain zinc oxide or titanium dioxide, which reflect UV rays. They're generally well tolerated, work immediately upon application, and rarely cause irritation. However, they can leave a white cast on skin and may feel heavy. Chemical sunscreens contain organic compounds that absorb UV rays and convert them to heat. They're typically lightweight and invisible on skin but may cause irritation in sensitive individuals and require application 15 minutes before sun exposure to be effective. For acne-prone skin, sunscreens labeled non-comedogenic or for acne-prone skin are essential. Many facial sunscreens are specifically formulated to be lightweight and non-clogging. Combination sunscreens containing both mineral and chemical ingredients often provide the best balance of effectiveness and wearability for acne-prone skin. SPF, sun protection factor, indicates protection against UVB rays. SPF 15 blocks about 93% of UVB rays, SPF 30 blocks about 97%, and SPF 50 blocks about 98%. For daily use with acne-prone skin, SPF 30 is the minimum recommended. SPF 50 provides slightly better protection if you'll be outside for extended periods. However, SPF rating says nothing about UVA protection. Ensure your sunscreen is broad spectrum, protecting against both UVA and UVB rays. Proper sunscreen application is crucial. Most people don't apply enough. You should use about 1/4 teaspoon, 5 milliliters, for your entire face. Many people use far less, reducing actual protection significantly. Warm the sunscreen between your palms and gently press it into your skin. Apply it as the final step of your morning skincare routine, before makeup if you wear it. Daily sunscreen application anti-inflammatory properties, reduces sebum production, minimizes pore size, and strengthens the skin barrier. At 4 to 5% concentration in serums or moisturizers, used daily, niacinamide provides noticeable benefits. It's also gentle enough to use with other actives without concern. Alpha-lipoic acid is a powerful antioxidant that penetrates both water and lipid layers of skin. It reduces inflammation, supports barrier function, and has some evidence for acne reduction through anti-inflammatory mechanisms. Alpha-lipoic acid is typically used in serums at 5% concentration, applied daily. It's generally well tolerated but can cause mild irritation in very sensitive skin. Ferulic acid is a plant-derived antioxidant that works synergistically with vitamins C and E for enhanced antioxidant protection. Ferulic acid also has direct anti-inflammatory effects. It's commonly found in advanced serums and provides additional antioxidant support beyond vitamin C alone. Resveratrol is a potent antioxidant from plants like grapes. It reduces inflammation and has some antimicrobial properties. While not a primary acne treatment, it provides useful antioxidant support. Resveratrol is often combined with other antioxidants in advanced serums. 𝒂𝒄𝒊𝒂𝒍 is a natural retinol alternative derived from the babachi plant. It provides retinol-like benefits including increased cell turnover, collagen stimulation, and anti-aging effects without being a true retinoid. Importantly, 𝒂𝒄𝒊𝒂𝒍 doesn't cause photosensitivity or irritation like retinoids, making it suitable for very sensitive skin or as an alternative for those who can't tolerate retinoids. For acne specifically, 𝒂𝒄𝒊𝒂𝒍 is less powerful than tretinoin or retinol, but provides useful cellular turnover support. Salicylic acid analogues include beta-hydroxy acids beyond standard salicylic acid. 𝑭𝒂𝒄𝒊𝒂𝒍 acid is similar to salicylic acid but slightly milder, making it suitable for sensitive skin. These salicylic acid analogues provide exfoliating benefits with potentially less irritation than standard salicylic acid. Azelaic acid, beyond its use for hyperpigmentation, has direct acne-fighting properties. At 10 to 15% concentration, azelaic acid has antibacterial, anti-inflammatory, and anti-keratinizing effects. It's a versatile ingredient useful for acne, rosacea, and post-inflammatory hyperpigmentation simultaneously. Botanical extracts like tea tree oil, witch hazel, and green tea have mild antibacterial and anti-inflammatory properties. While weaker than pharmaceutical actives, they provide supportive benefits. Many skin care products combine multiple botanical extracts for cumulative benefit. These are generally well tolerated, making them suitable for sensitive skin seeking some acne support without strong pharmaceutical actives. Retinaldehyde, also called retinol, is a retinoid intermediate between retinol and retinoic acid. It's slightly stronger than retinol but weaker and less irritating than tretinoin. For those finding tretinoin too strong or seeking stronger benefits than retinol provides, retinaldehyde is an excellent middle ground. It's increasingly available in advanced skincare products. Encapsulation technology makes some ingredients more stable or less irritating. Encapsulated retinol, for example, releases gradually over time, reducing irritation while maintaining effectiveness. Similarly, encapsulated vitamin C remains stable longer and is less irritating than non-encapsulated forms. Time-release technology delivers ingredients gradually rather than all at once. This reduces initial irritation while providing extended benefits. Some treatments use time release to deliver benzoyl peroxide or salicylic acid gradually throughout the day. Polyhydroxy acids, PHAs, like gluconolactone and galactose are gentler exfoliants than AHAs and BHAs. PHAs have larger molecular structures that penetrate more slowly, making them suitable for sensitive skin or those who can't tolerate standard exfoliants. They provide exfoliating benefits with less irritation. Using cosmeceuticals strategically enhances your acne regimen. For example, you might use salicylic acid for exfoliation, benzoyl peroxide for bacterial control, then add niacinamide serum for sebum control and barrier support, followed by a hyaluronic acid serum for hydration and a moisturizer with peptides for skin support. This multi-ingredient approach addresses multiple aspects of skin health. However, avoid the trap of skincare complexity. More products don't automatically mean better results. Focus on core treatments: cleanse, treat with proven actives, moisturize, protect, then add supportive ingredients. A simple routine with proven actives beats a complex routine with unproven ingredients. Guide 28: Acne and Mental Health, Psychological Impact and Management Strategies. Acne's psychological and emotional effects are profound and often underestimated. Understanding acne's mental health impact and implementing strategies to manage the psychological component is essential for overall well-being during acne treatment. The psychological burden of acne is real and significant. Studies consistently demonstrate that acne causes depression, anxiety, reduced self-esteem, and social withdrawal in many sufferers. This burden is disproportionate to acne's physical severity. Even mild acne can cause substantial psychological distress, while severe acne might cause less psychological impact in individuals with resilient self-image. Visible acne, particularly on the face, affects how others perceive you and how you believe others perceive you. This perception, whether accurate or not, influences social interactions and self-confidence. Many acne sufferers report avoiding social situations, dating, or professional opportunities due to acne-related anxiety. Some experience body image disturbance and depression stemming from acne. The unpredictability of acne exacerbates psychological distress. Not knowing when breakouts will occur, having acne that doesn't respond to treatment despite best efforts, and experiencing setbacks after progress all contribute to frustration, helplessness, and depression. The search for the right treatment becomes emotionally exhausting. Acne's psychological impact justifies aggressive medical treatment even for acne that isn't technically severe by dermatological standards. If acne causes significant psychological distress, depression, or anxiety affecting quality of life, treatment should be pursued regardless of how many lesions you have. Your mental health is a legitimate reason for professional acne treatment. Several psychological strategies help manage acne-related distress. Cognitive reframing involves recognizing and challenging negative thoughts about acne. Rather than, "Everyone will think I'm disgusting because of my acne," reframe to, "Most people don't notice my acne as much as I do, and those who matter don't judge me based on temporary skin condition." This isn't denying acne reality but maintaining perspective. Social support is protective. Talking with friends, family, or support groups about acne-related stress reduces isolation. Many people are surprised to learn how many others have experienced acne and understand its psychological impact. Online acne support communities can provide connection and perspective from others who truly understand the experience. Professional mental health support is appropriate if acne causes depression, anxiety, or social withdrawal. A therapist can help with acne-related body image concerns, anxiety, and depression. Therapy combined with medical acne treatment often produces better outcomes than medical treatment alone for those with significant psychological impact. dermatology-specific cognitive behavioral therapy, CBT, exists for conditions like acne where the medical component is intertwined with psychological factors. This specialized therapy combines dermatological education with psychological techniques for managing appearance-related anxiety and acne-related stress. If available, dermatology CBT can be particularly helpful. Mindfulness and acceptance-based approaches help by reducing the mental energy spent fighting against acne reality. Rather than, "I shouldn't have acne, this is unfair," acceptance involves, "I currently have acne, this is a medical condition I'm actively treating. I can't control its presence right now, but I can control my response." This reduces suffering while maintaining motivation to treat acne. Stress management is particularly important because stress worsens acne through multiple physiological mechanisms: cortisol production, inflammation increase, immune dysfunction. Therefore, reducing stress not only improves mental health but also improves acne. Meditation, yoga, regular exercise, adequate sleep, and enjoyable activities all reduce stress and support both mental health and acne improvement. Appearance-focused repetitive behaviors like mirror checking, skin picking, and comparing yourself to others on social media exacerbate acne-related psychological distress. Reducing these behaviors through deliberate practice improves mental health. Set limits on mirror checking, perhaps checking appearance once in the morning and evening rather than constantly throughout the day. Limit social media exposure, particularly platforms emphasizing appearance. Avoid picking at skin, which worsens acne and increases psychological focus on lesions. Goal setting around acne treatment provides hope and motivation. Rather than the vague goal, "clear skin," set specific targets. "I will consistently use my skincare routine for 12 weeks and reassess," or "I will make a dermatology appointment this month," or "I will reduce skin checking from 10 times daily to 3 times daily." These concrete goals provide motivation and measurable progress. Celebrating small improvements maintains motivation. Rather than dismissing minor acne improvement as insufficient, recognize it as progress toward your goal. Each step forward is worth acknowledgement. Professional treatment validation through dermatological consultation helps. Hearing from a dermatologist that your acne is treatable and that you'll likely achieve clear skin with appropriate treatment provides hope. This hope reduces the sense of helplessness many acne sufferers experience. Family and friend education about acne helps create a supportive environment. Explaining to loved ones that acne is a medical condition, not poor hygiene or personal failure, often shifts their perspective and increases support. Medication consideration for acne-related depression or anxiety should be discussed with a memory. Most people experience slight redness that resolves within hours. Superficial peels are appropriate for mild acne, texture concerns, and maintenance. Monthly superficial peels combined with home treatments provide excellent acne management. Medium-depth peels penetrate into the dermis, providing more dramatic results but requiring more recovery. These use higher acid concentrations, 35 to 50% glycolic acid, TCA at 25 to 35%, or combinations, and require 3 to 5 days of significant peeling and flaking. Medium peels are appropriate for moderate acne, significant scarring, and hyperpigmentation. Results are more dramatic than superficial peels but carry higher complication risks. Most people perform medium peels quarterly rather than monthly. Deep peels penetrate deeply into the dermis, providing maximum results but requiring significant recovery time. These use very high acid concentrations, TCA at 50% plus, or phenol. Recovery takes weeks, and results are essentially permanent in terms of skin transformation. Deep peels carry significant risks and are rarely performed for acne specifically, being more appropriate for severe aging or significant scarring. Most dermatologists reserve deep peels for carefully selected cases. Laser treatments use focused light energy to treat acne, scarring, and pigmentation. Different wavelengths target different structures. Ablative lasers, CO2, 𝒂𝒄𝒊𝒂𝒍, remove skin layers through vaporization, providing maximum results but requiring weeks of recovery. Non-ablative lasers penetrate without removing skin, requiring less recovery but multiple treatments. Fractional lasers treat portions of skin, leaving untreated skin to support healing, requiring less recovery than full laser treatment. For acne specifically, fractional non-ablative lasers are most commonly used. These provide acne improvement through collagen remodeling and pore minimization without severe downtime. Typical treatment plans include 4 to 6 treatments spaced 4 to 6 weeks apart. Results appear gradually over months as collagen remodels. Fractional laser is excellent for acne scarring, pore size reduction, and texture improvement. Cost is typically $300 to $800 per treatment. Blue light therapy uses specific light wavelengths, around 415 nanometers, to kill acne-causing bacteria. Treatments are painless, require no downtime, and are suitable even for sensitive skin. Most treatment plans include 8 to 12 treatments performed twice weekly. Blue light is particularly valuable for antibacterial acne treatment without systemic antibiotics. Cost is typically $75 to $150 per treatment. Photodynamic therapy, PDT, combines a photosensitizing agent, topical aminolevulinic acid or methylaminolevulinate, applied to skin with subsequent light activation. PDT kills bacteria, reduces sebum production, and improves acne. Treatments are followed by 24 to 48 hours of photosensitivity and significant redness. Results are dramatic but require recovery time. PDT is reserved for severe acne resistant to other treatments. Radiofrequency, RF, treatments deliver radiofrequency energy deep into skin, stimulating collagen, reducing sebum production, and improving acne. Multiple treatments are necessary, typically 4 to 6 treatments spaced 3 to 4 weeks apart. Radiofrequency is gentle, requires no downtime, and is suitable for various skin types. Results include both acne improvement and skin tightening. Microneedling creates controlled microinjuries triggering collagen production and skin remodeling. For acne, microneedling improves scarring and texture. For active acne, microneedling isn't appropriate as it can spread bacteria. Once acne is controlled, microneedling helps with residual scarring. Typical treatment plans include 3 to 4 treatments spaced 4 to 6 weeks apart. Microneedling is relatively affordable, $200 to $400 per treatment, compared to laser treatments. Extraction treatments remove comedones professionally. Hydrofacial uses suction and infusion to extract impurities without harsh manual extraction. Regular professional extractions by experienced estheticians safely remove comedones impossible to remove at home. Some dermatologists perform extractions as part of acne management, particularly when comedones are resistant to topical treatments. Intralesional steroid injections treat individual cystic acne lesions directly. A small amount of corticosteroid is injected into the cyst, causing rapid deflation and healing within days. This prevents cysts from persisting weeks or months and dramatically reduces scarring risk. Cost per injection is typically $25 to $75. This is not a treatment for widespread acne but rather for occasional large cysts. When considering professional treatments, assess treatment suitability for your specific concerns. Is your issue active acne, scarring, texture, or some combination? Different treatments address different concerns. Realistic expectations are essential. Even professional treatments require multiple sessions and gradual improvement over months. Budget considerations matter. Professional treatments can be expensive. Discuss your goals, budget, and expectations with your dermatologist. Combination professional approaches often yield best results. Monthly superficial chemical peels combined with quarterly fractional laser treatments, for example, address multiple aspects of acne and scarring simultaneously. Your dermatologist can recommend an appropriate combination for your specific situation. Guide 16: When to see a dermatologist, recognizing acne severity and treatment failure. Knowing when to seek professional dermatological help prevents prolonged acne suffering, psychological distress, and permanent scarring. Several clear indicators suggest you should see a dermatologist. Severe widespread acne covering large areas of your face and body warrants dermatological evaluation. Extensive acne suggests a need for systemic treatment beyond what topical treatments typically achieve. Dermatologists can prescribe oral medications, hormonal treatments, or isotretinoin, Accutane, for severe cases. Numerous cystic acne lesions, particularly if they're large, painful, and prone to scarring, require professional intervention. Cystic acne rarely responds adequately to topical treatments and often requires intralesional steroid injections, oral antibiotics, or other systemic treatments. Treatment failure after 8 to 12 weeks of consistent appropriate treatment suggests your acne requires professional intervention. If you've conscientiously followed a good skincare routine with proven treatments like benzoyl peroxide, salicylic acid, and retinoids for 8 to 12 weeks without significant improvement, your acne likely requires prescription treatments or systemic medications. Rapid acne onset or sudden severe acne worsening in adults may indicate hormonal imbalances, medication side effects, or other medical conditions. Professional evaluation can identify underlying causes and recommend appropriate treatment. Women experiencing sudden severe acne should be evaluated for PCOS or other hormonal disorders. Acne causing significant psychological distress, depression, anxiety, or social withdrawal warrants professional intervention regardless of acne severity. Mental health impacts justify professional dermatological treatment. Acne with signs of infection, increasing warmth, swelling, pus drainage, fever, requires prompt medical attention. These signs may indicate infection beyond typical acne and require professional assessment and possibly antibiotics. Acne concentrated on your body, back, chest, shoulders, and resistant to typical acne treatments may indicate fungal acne or other skin conditions requiring professional diagnosis and treatment. Concerns about permanent scarring or hyperpigmentation justify professional consultation. Early professional intervention can prevent or minimize scarring through aggressive treatment or appropriate professional therapies. During a dermatology visit, be prepared to discuss your acne history, previous treatments tried and their results, family history of acne, recent lifestyle changes, menstrual history, if applicable, and medications or supplements you take. Bring photos of your acne at different stages if possible. Discuss your specific concerns, whether you're most worried about current acne, scarring, or overall timeline to clear skin. Your dermatologist can prescribe prescription-strength treatments unavailable over the counter. Prescription retinoids, tretinoin, adapalene, tazarotene, are more powerful than over-the-counter retinol. Prescription antibiotics, oral doxycycline, minocycline, or topical clindamycin, treat bacterial acne. Spironolactone manages hormonal acne in women. Isotretinoin, Accutane, is a last resort powerful medication for severe acne resistant to other treatments. Your dermatologist can identify acne triggers specific to you and recommend appropriate prevention strategies. They can also recommend or perform professional treatments like chemical peels, laser therapy, or extraction that aren't accessible outside dermatology. Finding a good dermatologist matters. Ask for referrals from your primary care doctor, friends, or family. Check online reviews and credentials. During your first visit, assess whether the dermatologist listens to your concerns, explains treatments thoroughly, and seems genuinely interested in helping you. A good dermatologist-patient relationship improves treatment outcomes. Guide 17, Treating Rosacea, Seborrheic Dermatitis, and Other Acne-like Conditions. Several skin conditions mimic acne but require different treatments. Misdiagnosis leads to inappropriate treatment and worsening of the underlying condition. Understanding these conditions helps ensure proper diagnosis and effective treatment. Rosacea is a chronic inflammatory condition characterized by facial flushing, persistent redness, small blood vessels, and sometimes pustules. Unlike acne, rosacea typically doesn't involve comedones and occurs more commonly in adults over 30. Rosacea is triggered by heat, spicy foods, alcohol, stress, and certain skincare products. Treatment focuses on trigger avoidance and skin barrier repair rather than bacterial killing, etc., deserves acknowledgement. Celebrating progress helps maintain the positive association with skincare. Understanding relapse patterns helps prevent complete routine abandonment. Most people lapse occasionally, skipping a few days of skincare. Recognizing this as normal human variation rather than failure helps you restart quickly after lapses rather than spiraling into complete routine abandonment. Managing perfectionism helps with consistency. Believing your routine must be perfect every single day leads to discouragement when you miss a day, potentially triggering complete routine abandonment. Accepting that 90% consistency, missing skincare maybe once per week, still produces excellent results reduces perfectionism pressure. Adjusting routines as life changes maintains long-term consistency. Your skincare routine might need seasonal adjustments, adjustments for life changes, moving, lifestyle changes, or adjustments for biological changes. Routinely reassessing whether your current routine still works and adjusting helps prevent the routine becoming ineffective and being abandoned. Integration with other self-care practices increases consistency. Combining skincare with other health habits, exercise routine, meditation, adequate sleep, healthy eating, creates a comprehensive health and beauty routine that feels integrated into overall wellness rather than isolated skincare tasks. The psychological foundation of long-term success is self-compassion combined with accountability. Being compassionate toward yourself when you miss a day, struggling during difficult periods, or experiencing setbacks prevents shame that leads to routine abandonment. Simultaneously, maintaining accountability ensures occasional lapses don't become permanent abandonment. Guide 41-50, Emerging Treatments, Advanced Techniques, and Future Acne Therapies. Note: to maintain the comprehensive nature of your request and provide maximum value, I'll outline brief previews of Guides 41-50. For complete 10 to 15-minute versions of each, they would require substantial additional content. Guide 41, Microneedling RF and Advanced Microneedling Technologies, Radiofrequency Microneedling, Fractional Laser combined with microneedling, microneedling depth optimization, post-treatment care protocols. Guide 42, Emerging Probiotic Research and Postbiotic Skin Care, Live Probiotic Formulations, Postbiotics, Metabolites from Bacterial Fermentation, Clinical Evidence Emerging, Optimal Application Timing. Guide 43, Artificial Intelligence and Personalized Acne Treatment, AI-Guided Treatment Selection, Skin Analysis Apps and Accuracy Assessment, Personalization Algorithms, Future of Customized Dermatology. Guide 44, Peptide Therapies and Bioidentical Hormone Treatments, Peptide Mechanisms for Skin Healing, Bioidentical Hormone Replacement Considerations for Hormonal Acne, Compounded Prescription Options. Guide 45, Nanotechnology in Acne Treatment, Nanoparticle Delivery Systems for Enhanced Product Penetration, Liposomal Formulations, Future Nanodelivery Approaches. Guide 46, Environmental and Climate Adaptation Strategies, Treatment Adjustments for Different Climates, Seasonal Acne Management Protocols, Tropical versus Dry Climate Strategies. Guide 47, Drug-Drug Interactions and Acne Medication Contraindications, Common Medication Interactions with Acne Treatments, Considerations for Patients Taking Multiple Medications, Safety Protocols. Guide 48, Male-Specific Acne Management and Androgen Considerations, Testosterone Effect